rheumatological diseases caused by DAO deficiency. The diagnosis of fibromyalgia is not easy. Sometimes it takes years to diagnose it. This is because no abnormalities are seen in the physical examination of the person. The doctor cannot assess morning stiffness, extreme pain, chronic fatigue with the naked eye, because they are not quantifiable. But today, there are new biomarkers, such as the activity of the enzyme diamine oxidase, DAO. Unfortunately, few doctors are up to date on this subject. To detect the activity of the DAO enzyme, diagnostic methods and new treatments have been developed. Fibromyalgia, muscle pain, chronic fatigue due to DAO deficiency and associated diseases. Fibromyalgia, chronic fatigue and widespread muscle pain. Fibromyalgia is a disease that groups symptoms and musculoskeletal disorders. Patients who suffer from them suffer from extreme fatigue, persistent pain, stiff muscles, difficulty sleeping, headaches, memory loss among others, which generally prevent the person's daily routine. Fibromyalgia symptoms, chronic fatigue and widespread muscle pain. The main symptom that characterizes fibromyalgia is generalized musculoskeletal pain throughout the body and/or muscle stiffness that affects at least 3 anatomical areas and lasts for more than 3 months. The pain is generally very intense and on many occasions it is very difficult to describe. It generally worsens with intense physical activity, cold and emotional stress. Fibromyalgia symptoms occur mostly in the lower back, neck, trapezius, chest, and thighs. Some people have muscle spasms and/or localized contractures. Other symptoms may include headache, migraine, restless leg syndrome, difficulty concentrating, difficulty remembering or forgetfulness, tinnitus, and lack of motor coordination. In many patients, fibromyalgia also causes sleep disorders, intense weakness, depression, anxiety attacks, digestive problems such as constipation. Chronic fatigue is always present in all the activities carried out by fibromyalgia patients, which makes performing daily tasks a great difficulty for them. Depending on the severity and the degree variation, this tiredness can range from bearable to a disability that limits tasks both personally and professionally. Influence of histamine in fibromyalgia, chronic fatigue and general muscle pain. Currently there is no cure for fibromyalgia. Current treatments are to relieve symptoms. Among the treatments we find FibroDAO 60 capsules of Dr. Health. Histamine in the body causes dilation of blood vessels, as well as its accumulation in muscle tissue, and this is what causes pain and chronic fatigue. Histamine mediates many processes such as inflammation, gastric acid secretion, and regulation of immune function. Histamine is produced by our body, but histamine can also come from abroad, that is, ingested with food. See the article on how DAO can help us at the end. Diamine oxidase, DAO, enzyme. The best way to treat fibromyalgia, chronic fatigue, and muscle pain is by inactivating ingested histamine. The primary function of DAO is to prevent histamine ingested through food from reaching the bloodstream from the intestine. We find D-amino oxidase in the small intestine, kidneys, liver, and leukocytes. Histamine is produced continuously in the body and is excreted via the intestine, and is degraded by DAO when it passes through the intestinal mucosa. DAO can be inhibited by alcohol, some drugs. But, on the other hand, some people have very low levels of DAO in the blood. This causes the levels of histamine in the blood to be high, which is why certain pathologies are triggered, such as fibromyalgia, muscle pain or chronic fatigue. Treatment of fibromyalgia, muscle pain and chronic fatigue with DAO D-amino oxidase detection is an important biomarker for diagnosing fibromyalgia, chronic fatigue or muscle pain. For this, it is important to carry out a genetic study of the genotypes involved as well as plasma measurement. Once diagnosed, DAO supplementation breaks down excess histamine, thus preventing the development of fibromyalgia symptoms, chronic fatigue, and widespread muscle pain. In addition to the contribution of DAO supplements, it is necessary to carry out a diet poor in foods with a high histamine content. You also have to avoid taking histamine-releasing drugs. Bibliographic references: Garcia Martin et al. Histamine Pharmacogenomics. Pharmacogenomics 2009, 10, 5, 867-883. Maint et al. Histamine and histamine intolerance. Am J. Klin Nutter 2007, 85-1185 1196. Jarisch et al. Histamine intolerance. Histamine and Seekrankheit, 2 Eden. Stuttgart, Germany, Georg Theme Verlag KG, 2004. Izquierdo Casas et al. Low serum diamine oxidase, DAO, activity levels in patients with migraine. J. Physiol Biochem 2018, 74, 1, 93-99. Garcia Martin et al. Diamine oxidase 10,156,191 rupees and 2,052,129 rupees variants are associated with the risk for migraine. Headache 2015, 55, 2, 276-86. Agundez et al. The diamine oxidase gene is associated with hypersensitivity response to non-steroidal anti-inflammatory drugs. PLOS 2012, 7, 11, E47571. Headache Classification Committee of the International Headache Society, IHS. The International Classification of Headache Disorders, 3rd ed. Cephalalgia, 2018, 38-1-211. Image from https://synaptica.es/fibromyalgia-n-twitter/article extracted from the LinkedIn of bio-pharma.es. An article by Catalina Vidal Ramirez, pharmacist, manager at bio-pharma.es. The information presented in this article is in no way a substitute for the advice of a physician. Any mention in this article of a product does not represent the endorsement of the SDGs, Sustainable Development Goals, for that product.